Are you taking vitamins thinking you're protecting your heart, but actually putting yourself at risk for dangerous blood clots? Today, I'll reveal the 3 vitamins that can increase blood clot risk in seniors over 65 and give you safe, science-backed alternatives that actually protect your cardiovascular health. The second vitamin on this list is found in nearly every senior's medicine cabinet. Yet most doctors never warn patients about its hidden dangers. Last month, cardiologist Dr. Amanda Chen treated 72-year-old Arthur from Phoenix, who suffered a pulmonary embolism after taking high doses of what he thought was a heart-healthy vitamin. Arthur had no idea this supplement was increasing his clotting risk. After stopping the vitamin and following proper protocols, his clotting markers returned to normal within weeks. Vitamin 1. High-dose vitamin K supplements. Vitamin K supplements can turn your blood into a clotting hazard if you're not careful. While vitamin K is essential for bone health and blood clotting function, taking it in supplement form can dangerously tip the balance in your cardiovascular system. Research from Harvard Medical School shows that high-dose vitamin K supplementation can interfere with natural blood flow regulation, increasing clot formation risk by up to 40% in seniors. The problem occurs because vitamin K directly affects proteins that control blood clotting, and when you flood your system with synthetic versions, you override your body's natural regulatory mechanisms. Your liver struggles to process these artificial doses, leading to unpredictable clotting patterns that can be life-threatening. The mechanism is complex but dangerous. Vitamin K activates clotting factors in your blood, and when you take too much, these factors become hyperactive, making your blood sticky and prone to forming clots where they shouldn't. The issue becomes more complex for seniors because aging naturally affects how our bodies process vitamins and minerals. As we get older, our liver function decreases by approximately 20 to 30%. Our kidney filtration slows down significantly, and our digestive system becomes less efficient at absorbing nutrients properly. When you add high-dose vitamin K supplements to this already compromised system, you create a perfect storm for clotting complications that can be deadly. Many seniors take vitamin K thinking it will strengthen their bones and prevent fractures, but they don't realize that excessive amounts can make their blood dangerously thick and prone to forming clots in arteries and veins throughout their body. The therapeutic window for vitamin K becomes much narrower as we age, meaning the difference between a helpful dose and a dangerous dose shrinks considerably. Consider Maria from Denver, who developed painful leg clots after taking 500 micrograms of vitamin K daily for bone health. She had no family history of clotting disorders and was otherwise healthy, exercising regularly and eating well. Within 3 months of starting the supplement, she experienced swelling and pain in her left leg that sent her to the emergency room. Blood tests revealed elevated clotting factors directly linked to her vitamin K intake, and ultrasound confirmed multiple blood clots in her deep leg veins. The consequence of excessive vitamin K supplementation is that it can override your body's natural clotting balance, potentially causing strokes, heart attacks, or pulmonary embolisms. Your blood becomes more likely to form clots when it should flow smoothly, putting dangerous pressure on your cardiovascular system. These clots can travel to your brain, causing strokes, or to your lungs, causing potentially fatal pulmonary embolisms. The risk is particularly high for seniors who may already have compromised circulation or existing cardiovascular conditions like high blood pressure or diabetes. Get vitamin K from leafy greens like spinach, kale, and broccoli instead of supplements, limiting your intake to natural food sources only. Check your supplement bottles right now. High-dose vitamin K could be putting you in immediate danger. Vitamin 2. Excessive vitamin E. Over 400 IU daily. Did you know that the vitamin E you're taking for heart health might actually be harming your circulation? Many seniors take high-dose vitamin E supplements, believing they're protecting their hearts from oxidative damage, but research shows the opposite can be true. The Mayo Clinic reports that vitamin E doses above 400 IU daily can interfere with blood-thinning mechanisms and increase clotting risk in adults over 65. This happens because excessive vitamin E affects platelet function and interferes with natural anticoagulation processes in your blood. Your platelets become more likely to stick together and form dangerous clots, especially in smaller blood vessels where circulation is already compromised. The irony is that vitamin E was once promoted as a heart-healthy supplement, but clinical trials have repeatedly shown that high doses can actually increase cardiovascular risk rather than reduce it. The problem with vitamin E supplementation is that most people don't understand the difference between natural and synthetic forms, or how much is actually safe for their age group. Natural vitamin E from food sources comes with other compounds called tocopherols and tocotrienols that help your body process it properly, while synthetic vitamin E supplements flood your system with isolated alpha tocopherol that can cause dangerous imbalances. When you take doses above 400 IU daily, you're essentially overwhelming your body's ability to use the vitamin properly, causing it to interfere with normal blood clotting mechanisms. This interference can make your blood more viscous and prone to forming clots, particularly in your coronary arteries and cerebral blood vessels. The synthetic form of vitamin E also depletes other important antioxidants in your body, creating oxidative stress that can damage blood vessel walls and make clotting more likely. Robert from Texas experienced serious clotting issues after taking 800 IU of vitamin E daily for 6 months, believing it would protect him from heart disease after his brother's heart attack. He developed chest pain and shortness of breath that landed him in the cardiac unit, where doctors discovered elevated clotting markers directly related to his vitamin E intake. Robert's cardiologist explained that his high-dose vitamin E was actually increasing his heart attack risk rather than protecting him, and the supplement had created a dangerous imbalance in his blood chemistry. The consequence of taking excessive vitamin E is that it can make your blood more likely to form dangerous clots in your heart, brain, or lungs. These clots can block vital blood flow to organs that need constant circulation to function properly. Heart attacks, strokes, and pulmonary embolisms become more likely when your blood clotting system is disrupted by excessive vitamin E. The irony is that many people take vitamin E specifically to prevent these conditions, not realizing they're increasing their risk significantly. Additionally, high-dose vitamin E can cause bleeding problems by interfering with vitamin K function, creating a dangerous seesaw effect where your blood might clot too much or too little unpredictably. Limit vitamin E to 15 milligrams, 22 IU, daily from natural food sources like nuts, seeds, avocados, and vegetable oils. Stop taking high-dose vitamin E supplements immediately. Your circulation depends on it. Vitamin 3, synthetic vitamin A, over 10,000 IU daily. Synthetic vitamin A in high doses can make your blood dangerously thick and prone to clotting. Unlike natural vitamin A found in colorful vegetables, synthetic vitamin A supplements concentrate massive amounts of retinol that your body struggles to process safely. Johns Hopkins cardiologists warn that synthetic vitamin A supplements exceeding 10,000 IU daily can increase blood viscosity and clotting risk, especially in seniors with existing cardiovascular conditions. The problem occurs because synthetic vitamin A accumulates in your liver and fat tissues, creating toxic buildups that interfere with normal blood chemistry. Your blood becomes thicker and more likely to form clots, particularly in areas where circulation is already compromised. The accumulation happens because vitamin A is fat-soluble, meaning it doesn't wash out of your system easily like water-soluble vitamins do. Instead, it builds up in your tissues over time, reaching levels that can become toxic and dangerous. The danger of synthetic vitamin A becomes more pronounced with age because seniors process fat-soluble vitamins differently than younger adults. As we age, our liver function decreases significantly, making it harder to clear excess vitamin A from our system. This leads to accumulation in tissues, where it can reach toxic levels that affect blood clotting mechanisms and overall cardiovascular health. Synthetic vitamin A also interferes with vitamin K metabolism, creating a double effect that makes clotting more likely while simultaneously affecting your body's ability to regulate clotting properly. Many seniors take high-dose vitamin A supplements thinking they're boosting their immune system or improving their vision, but they're actually creating cardiovascular risks that can be life-threatening. The toxic effects of vitamin A accumulation include liver damage, increased intracranial pressure, and most dangerously, altered blood chemistry that promotes clot formation. Eleanor from Michigan developed serious circulation problems after taking 25,000 IU of synthetic vitamin A daily for immune support during cold season. She noticed persistent headaches, dizziness, and leg pain that worsened over several weeks. Blood tests revealed elevated clotting factors and liver enzymes, both directly linked to her vitamin A intake. Eleanor's doctor immediately discontinued the supplement and monitored her closely as her clotting levels gradually returned to normal over the following months. But the damage to her liver took nearly a year to fully resolve. The consequence of excess synthetic vitamin A is that it can thicken your blood, making clots more likely to form and block vital arteries throughout your body. These clots can cause heart attacks, strokes, or deep vein thrombosis, all of which can be fatal or cause permanent disability. The thickened blood also puts extra strain on your heart, forcing it to work harder to pump blood through your circulatory system. This increased workload can lead to heart failure or other serious cardiovascular complications, particularly in seniors who may already have compromised heart function. The liver damage caused by vitamin A toxicity can also affect your body's ability to produce proteins necessary for proper blood clotting, creating unpredictable and dangerous clotting patterns. Replace synthetic vitamin A supplements with natural food sources like carrots, sweet potatoes, spinach, and bell peppers instead of taking concentrated supplements. Replace synthetic vitamin A supplements with natural food sources today. Your heart will thank you. Additional considerations for safe vitamin use. Understanding how vitamins interact with your cardiovascular system becomes crucial as you age because your body processes nutrients differently than it did when you were younger. Your liver, kidneys, and digestive system all work less efficiently, making it harder to clear excess vitamins from your system. This means that doses that might have been safe in your 40s or 50s can become dangerous in your 60s and beyond. Fat-soluble vitamins like A, D, E, and K are particularly problematic because they accumulate in your tissues rather than being easily excreted like water-soluble vitamins. This accumulation can lead to toxic buildups that interfere with normal blood clotting mechanisms and increase your risk of cardiovascular complications. The half-life of these vitamins in your body can be weeks or months, meaning that even after you stop taking them, they continue affecting your blood chemistry for extended periods. The timing of vitamin supplementation also matters more as you age, particularly if you're taking any medications that affect blood clotting. Many seniors don't realize that common over-the-counter vitamins can interact with prescription medications, creating dangerous combinations that increase clotting risk. Even seemingly harmless multivitamins can contain doses of fat-soluble vitamins that exceed safe levels for seniors. The key is understanding that more isn't always better when it comes to vitamin supplementation, and that your body's changing needs require a more cautious approach to supplement use. Regular monitoring becomes essential because what's safe today might not be safe next month as your body continues to age and change. These 3 vitamins can seriously endanger your cardiovascular health when taken in high doses or synthetic forms. But the good news is that natural food sources provide all the nutrients you need without the dangerous clotting risks. Focus on eating a colorful diet rich in vegetables, nuts, healthy oils, and whole foods instead of relying on potentially dangerous supplements. Your heart and circulation will be much safer with this natural approach, and you'll get better nutrition overall from real food sources that work with your body's natural processes. If you're currently taking any of these vitamins, like this video and tell me in the comments which one surprised you most. Subscribe for more heart-healthy advice that could save your life, and share this video with any senior who needs to know these critical warnings. You might prevent a dangerous clotting event.